Hi everyone, my name is Mia Harris. I did my flashcard presentation on glaucoma. Glaucoma is a group of chronically progressive disorders of the eye that causes damage to the optic nerve. The damage to the optic nerve is often caused by increased intraocular pressure or the pressure within the eye, which can result from build-up of aqueous humor or the fluids in the eye, or can also be a result of blockage of the drainage angle within the eye. So glaucoma is a leading cause of blindness in people over 60 years old. There are several types of glaucoma, but the two main categories are primary open-angle glaucoma and angle closure glaucoma. So with primary open angle glaucoma, the drainage angle within the eye is open, but the meshwork or fibers that helps to drain the eyes becomes inefficient over time, resulting in increased intraocular pressure, which then leads to damage to the optic nerve. Angle closure glaucoma occurs when the drainage angle within the eye is blocked or is too narrow, preventing the outflow of aqueous humor and resulting in increased intraocular pressure and ultimately damage to the optic nerve. So pathophysiology, the increase in intraocular pressure can damage the optic nerve in two ways. By exerting mechanical pressure on the delicate nerve fibers and also impairing the blood supply to the optic nerve. So the pressure that is exerted on the optic nerve can compromise the structural integrity of the nerve, leading to a process known as axonal compression. So over time, the sustained compression on the nerve fibers can cause damage and contribute to vision loss. Increased intraocular pressure can compress the small blood vessels that supply oxygen and nutrients to the optic nerve, which can lead to ischemia, damage to the nerve tissues, and loss of functions. So damage to the optic nerve itself involves degeneration of the optic nerve with loss of the retinal ganglion cells, the thinning of the retinal nerve fiber layers, and increasing destruction of the optic disc. The optic nerve transmits visual images or information from the eye to the brain. So the progressive loss of the retinal ganglion cells leads to increased impairment of the visual fields, including diminished contrast and color perception and difficulty reading, and ultimately blindness if not treated. Risk factors. Advanced age is a risk factor because with age, the drainage system in the eye, known as the trabecular network, becomes less efficient in maintaining the normal intraocular pressure, resulting in increased intraocular pressure. So changes in the optic nerve also occurs with age, making it more susceptible to damage. Increased intraocular pressure obviously causes damage to the optic nerve. Severe myopia, or nearsightedness. So people who are nearsighted or have severe myopia, they have structural alterations in the eye. The anterior chamber of the eye, which is the space where the iris and the cornea meets, can be shallow in people with myopia. And this can affect the drainage of the aqueous humor and of course leading to increased intraocular pressure. Genetics, family history of glaucoma is a risk factor. People of African, Hispanic, or Asian descent have high eye pressure, which increases the risk for glaucoma. Hypertension is a risk factor because high blood pressure affects all the blood vessels in the body, including the blood vessels that supplies the nerve and the retina, which causes damage to these crucial organs in the eye. Eye injury. So any injury such as a blunt force trauma or direct blow to the eye obviously will cause damage to the eye or the optic nerve. Long-term use of corticosteroids is a risk factor because corticosteroids are anti-inflammatory and they can affect the fluid balance within the eye. Then that will also cause increased intraocular pressure. Major signs and symptoms. So the eye pain or pressure or headache, these are associated with increased intraocular pressure due to the fluid buildup, which can lead to the sensation of pain or pressure or headache. Rainbow color halos around lights. So this is a sign of intraocular pressure, mainly when the cornea of the eye is swollen. So when the cornea is swollen, it disperses lights differently. The dispersion of lights can create a rainbow halo around lights, especially dim lights. Low vision, this just means blurred vision, narrow vision, loss of peripheral vision. These are all signs of gradual vision loss due to damage of the optic nerve. Nausea and vomiting is a sign too, because increased pressure in the cornea can excite the vagal nerve, leading to nausea and vomiting. Also red eye, so increase in the eye pressure will be seen as redness in the eye. Diagnosis testing, dilated eye exam. So this is when they dilate the pupils to be able to view the optic nerve in the back of the eye to look for any abnormalities. Gonioscopy is done to examine the angle where the iris and the cornea meets in the eye. So that's check for the pressure in the cornea. Optical coherence tomography is done to look for changes in the optic nerve that may indicate glaucoma. It is a non-invasive imaging method that uses reflected light to create pictures in the back of the eye. Ocular pressure test. This one measures the pressure inside the eye. So the normal eye pressure is between 10 to 21. Pachymetry measures the thickness of the cornea, just to look for swelling in the cornea. The slit lamp exam is done to examine the inside of the eye using a special microscope called a slit lamp. Visual acuity test. This is a test that is done to look for vision loss. We all know this test when you look at numbers or letters on the wall from a certain distance to see how well you can see those numbers or letters. The visual field test. This one is done to check for changes in the peripheral visions. So just to check to see if you can see from the side of the eyes without turning your head. This is what this test is. So this is the end of my presentation. These are my references, and thank you for listening.